Hello, this is Chris Hawk, Master of Public Health candidate at Purdue University, and I am presenting my grant proposal, which involves the Girl Scouts of San Diego and developing a pandemic safety training through the Girl Scout Outreach Program. Some background, Girl Scouts San Diego has been active for over 100 years with troops established in the county and surrounding areas. This community organization, has been a vital mechanism for young girls, particularly those who are underserved or economically disadvantaged, to being able to participate in activities that develop real life skills, provide physical activity and mental health validation. They really play a critical role for girls in the county, like I said, especially those in economically disadvantaged or underserved situations, being able to engage in physical activities, gain important skills, especially STEM training, and things of that nature. So it's a real critical asset to the community. And the purpose of the proposal is really acknowledging the fact that the current pandemic situation, COVID-19 situation, has essentially put a stop to many of these key critical activities. So the girls aren't being able to engage in programs and activities in the same way that they were prior to the start of the pandemic. So this has created a situation where there is some, legitimate threat to positive both physical and mental health outcomes. So the crux of the proposal is to basically develop a pandemic safety training program through the Girl Scout Outreach Program, which is the arm of the organization that specifically focuses on serving these underserved and economically disadvantaged girls in their communities. And through that organization, conduct a series of trainings, both focused on organizational management, so they have the knowledge of pandemic safety, what the various issues are, what all the variables concerned are, so that they can go and essentially identify key programs and activities that under a new safety protocol could be conducted. So this could involve, further use of Zoom or other remote learning. It also could involve working with small groups of girls, kind of mini troops, where it's easier to, institute social distancing, personal protective equipment, things of that nature. One of the positive things is that Girl Scouts San Diego has a good deal of infrastructure in place. They have a couple of different training centers. They have camps that they can utilize, so there's not much in the way of infrastructure costs. Most of the costs will be allocated around developing the training, providing the training, and then basically initiating the activities after the members and scouts have been trained, so that they can perform these activities safely and get that physical, mental enrichment that they have been lacking since the start of the pandemic. So the organizational management is the first phase of the training, and what that really entails, again, is teaching them different safety protocols that can be utilized and enabling them to make decisions about which programs or activities can be launched. The second phase of the training involves training volunteers and leaders on how to conduct these activities safely, what they need, making sure they have adequate safety supplies, everything from masks to hand sanitizer, and things of that nature, making sure that they are conducting these programs and activities in spaces that provide for adequate social distancing. There's also an important train-the-trainer aspect for the second phase, where the leaders and volunteers will be trained on how to provide training instructions to the members and the scouts who are participating in these activities. So at the beginning of these activities, there will be a training provided by the leader or volunteer on how they need to behave, how they need to conduct the activities so that they stay within this safe zone. And then the third phase, that's really the third phase, is the members and the scouts getting this training and actually initiating these activities. So we envision this for kind of a pilot phase out initially. Initial training phase, number one, we're about looking to get up to 25 different organizational management staff members trained. Then the next phase is looking to train up to 150 volunteers and leaders. And then have the capacity after that training's been conducted for up to 60 different programs and activities that could involve as many as 500 girls total. So we're not going to cover the entire deficit that has been created by pandemic, but it's going to give us a good tool and mechanism to start getting this out there and really helping the girls that are most adversely affected by not being able to engage in these activities. So you see the project timeline starts in January of 2020, and pretty much the actual training and activities go through August of 2021, starting in January of 2021, kind of finishing up in August of 2021, with evaluation continuing to be done through the end of the year. The evaluation plan will include a scoring matrix that basically enables the leaders or volunteers to assess during the course of the activity whether they're maintaining that safe zone. So depending on if the girls are wearing their personal protective equipment, if they're exercising adequate social distancing, if they're using adequate personal hygiene habits, these are all scored by the volunteers during the course of the training. And if anytime they drop into a level that is deemed unsafe based on combination of these different inputs, they will immediately suspend the activity and reevaluate. And then there will be also a 10-day post-program or activity questionnaire that's provided that kind of checks on have people had symptoms, have there been any positive cases in any of the participants, and this will be used to kind of inform further expansion of this program. So again, we're really hoping to get the girls active, get them involved both mentally and physically, to promote those positive physical and mental health outcomes that have been so clearly documented. And we really think this will make a difference. Again, we will always use safety protocols as a mechanism to guide this activity, from point A to point B all the way through the end. So I want to thank Dr. Rigger, Dr. Amelf, both for guidance and help during this semester as we wrap this program up. And I also want to thank in particular Lucy Esparza, who's the manager of Girl Scouts Outreach, who I've been working with to develop this proposal. Thank you very much for your time.